Good evening, Berkeley, and thank you for joining us for this virtual town hall meeting on the City of Berkeley's response to the COVID-19 pandemic. I'm Mayor Jesse Edegin. I'm joined by a panel of city leaders, including our city manager, Dee Williams-Ridley, our City of Berkeley Public Health Officer, Dr. Lisa Hernandez, and the Director of the Department of Health, Housing, and Community Services, Dr. Lisa Varhus. And we're here today to answer your questions and provide updates on our work to address this public health emergency. And before I turn over to Dr. Hernandez, I just want to reflect on the fact that this town hall meeting comes on the 1-year anniversary of the City of Berkeley and the Bay Area region's decision to issue a shelter-in-place order. In fact, that anniversary is this Wednesday. And it seems like a lifetime ago when the City of Berkeley joined other local public health departments to take the unprecedented step of issuing a shelter-in-place order in order to help control the spread of the novel coronavirus and to ensure that we can protect the health and safety of our community. And so much has happened since then. We sadly know that, in the United States, over 500,000 people have lost their lives. In the City of Berkeley, well over 30 individuals have succumbed due to COVID-19. Many businesses have closed. People have lost their jobs. It's been one of the most challenging times in the history of our city, our nation, and our world. But I think it's important that we reflect on this, what I think is an inflection point, and I think recognize, that the early action that we took in Berkeley and in the Bay Area undoubtedly saved lives. And the leadership that we demonstrated here in the Bay Area inspired other regions, other states to take action to issue shelter-in-place orders. That was critical at the early stage, and still to this day is critical to helping control the spread of COVID-19. And I want to just lift up that while the impacts of COVID have been significant on our community, if it wasn't for the early action that we took and the thoughtful public health measures that were put in place and that we're still continuing to practice, we certainly would have seen more people lose their lives due to COVID-19. And, it has helped us manage this virus, despite the fact that we are a city of 120,000 residents. We have a major public university in our city. We have not seen as high of a positivity rate as we may have initially anticipated. And that is really due to the incredible sacrifice and work of our community to really step up and to respond to the public health requirements that we have put in place, to shelter in place, to practice physical distancing, to wear a face covering, and to help minimize the spread of this virus. And I just want to take this opportunity to thank once again the people of Berkeley for all the sacrifices that you have made, for all that you've done to get us to this point. And we will certainly be providing information about our vaccination program and next steps. We see light at the end of the tunnel, but I want to recognize that this did not come easy, and that we have a lot of rebuilding to do even after we get through this emergency. So as we're at this point, this and what I think is really an inflection point to reflect on where we are, I think many of us didn't expect that this was going to be a whole year. I think we thought it was going to be maybe a few weeks or a few months, and now a whole year has gone by, and we are not out of this pandemic yet, despite the fact that we are ramping up vaccinations of individuals. We are not out of it yet. So I want to just reflect on this 1-year anniversary to thank the people of Berkeley for your commitment to science, for taking this public health emergency seriously. And I want to thank the city staff who really have stepped up in really incredible ways, including the leaders here. And I think all these collective efforts have really helped save lives in our community, but we have more work to do in these next few weeks and months as we're ramping up getting people vaccinated. Even after people are vaccinated, we still need to follow public health precautions. So with that, I want to turn it over to Dr. Hernandez, our public health officer. And Dr. Hernandez, if you can provide us an update on the number of cases in Berkeley, where we're at with the tiered status, any other information you'd like to share with the Berkeley community.
Sure. Good evening, Mr. Mayor, other panelists, esteemed panelists, and City of Berkeley residents. Thank you for having me here today. I'll start with the numbers as usual, starting with Alameda County and then focusing in on City of Berkeley numbers. For Alameda County, and this is not including City of Berkeley cases, there are now 78,684 cases, confirmed cases of COVID-19. Hospitalizations total, currently in the hospital at this point are 114 individuals. That does include some City of Berkeley residents. And in the intensive care unit, there are currently 33 individuals in Alameda County intensive care units. So those numbers are still high, both for hospitalization and ICU, but are definitely lower than our peak, the peak numbers that we saw back in late December for both where we peaked at over 450 individuals hospitalized at the end of December, and about 120 a little under 125 individuals in the intensive care unit. So these numbers are still too high, but are definitely way better than where we were just 3 months ago. In terms of deaths total, 1,292 deaths for Alameda County. And I'll report on the state indicators. This is the case rate and the test positivity. These are the indicators that are used to determine where we are in terms of our tier status. They get updated every Tuesday, or actually every Monday, reported on Tuesday. So I still have the numbers from last week. What I can tell you is that they'll be lower tomorrow, which is great news. So in terms of case rate for the county, there's an unadjusted case rate of 7.1 cases per 100,000 per day, and adjusted is 4.8 cases per 100,000 per day. And it gets that case rate gets adjusted using equity metric, looking at how the county is doing with testing in certain populations. So we're at 4.8 for the case rate, and test positivity, the county is at 1.8%. So when we look at City of Berkeley case counts, we are at a total of 3,362 confirmed cases of COVID-19. We're averaging about 6 cases per day. Again, these case numbers and cases per day peaked late in late December, and we're definitely lower than we have been, thankfully. Hospitalization total, we have had 112 individuals hospitalized that were City of Berkeley residents. Deaths, a total of 36 individuals, and total tests that are performed and reported on City of Berkeley residents now are just under 300,000. So that is 275,079 tests reported and on City of Berkeley residents. We're averaging about 913 tests per day, and our total percent positive since the beginning of the pandemic is now dropped to 1.4%. So that's nicer number than I reported some times ago. When we calculate as a city our state indicators, we do this on our own through our own epidemiologic staff, and we can calculate our case rate unadjusted, which is 5.99 cases per 100,000 per day, and our test positivity is under 1% at 0.34%. So that's excellent numbers. I'll just report very briefly on our vaccine efforts. I believe we'll get more updates later on in the presentation, but just wanted to let you know for City of Berkeley residents, 51,000 vaccine doses have been administered to City of Berkeley residents. Actually, a little bit more than that, but let's just round down, actually. And of those folks that are fully vaccinated, about 16% of Berkeley residents 16 years or older are fully vaccinated. So that is excellent news. And we are continuing to vaccinate every day. So this number is getting better and better. I do want to talk about the blueprint update. Effective last week, both Alameda County and of course City of Berkeley advanced to the red tier. And this means that restaurants, gyms, museums, movie theaters can now operate with capacity limits indoors. Also, which was added just recently, actually on Saturday, wineries, breweries, and distilleries were allowed to open outdoors, and they had specific modifications that they had to utilize to operate, which includes reservations, 90-minute limit, seating, specific seating and tables only, and they had have to have a limited service hours, where the service hours have to be limited. They have to close by 8 p.m. Bars remain closed. So other things that we have, and this is all on our website. Also, I meant to say that our vaccine data is also on our website. That's new, and that is also found where we have our case data as well. So that's something to follow along, and there's more detailed breakdown. But in terms of back to the blueprint, indoor dining is at 25% or 100 people, whichever is fewer. Groceries are now able to operate at full capacity. And then retail can operate at 50%. Libraries can operate at 50%. Movie theaters can operate indoors at 25% capacity, museums at 25% capacity, and then middle schools and high schools and all other schools that grades that haven't opened are able to open as long as they post the plan on their website, and that has to be posted 5 days prior to opening, and there does not need to be an approval, which was something that needed to happen in the purple tier. The other thing I just want to bring up is about vaccines in terms of what the City of Berkeley and 10 other Bay Area health jurisdictions released a press release today, urging people or letting people know that we fully support all 3 available vaccines. And there's often a question about which vaccine should I take? And the answer is the vaccine, the first vaccine that's available to you when you're able to get vaccinated. People on this call know I'm still waiting for my mom to get vaccinated. She's not in California. She's in another state. And that's my advice to my mom, which is, Mom, as soon as you get a vaccine, just take it. And she's fortunately listening to her daughter, and she will take that vaccine. So just want to let you know that is the same advice I give to my mom that I give to everyone here, which is take the first vaccine that's available. What we know is that all 3 vaccines demonstrated that they are highly effective. They prevent symptomatic illness and hospitalization. They're 100% effective in preventing deaths from COVID-19, which is really what we want. We want severe disease and deaths to be eliminated. And that's what we're seeing with these vaccines. The last thing I just want to update is on UC Berkeley. I've reported before about outbreaks that we've had both on campus and off campus. I believe I mentioned last time we were here that the on-campus outbreaks have been controlled and that the campus is back to full activity for the students. Off campus, things are improving. We're still working, though, with some of the off-campus houses, the congregate settings, and we're working with the Greek organizations, with any of the co-ops, as well as the Cal administration. So I'll stop there, Mr. Mayor, and hand it back to you.
Thank you so much. Dr. Varhus, before I go to the city manager, is there anything you'd like to update the Berkeley community on with respect to vaccines or sort of our coordination with the school district?
So I will add that many of you will have noticed that last week the city published a, shared what we've been saying since October, which is that it is safe to reopen schools under the state, following the state's guidance. We've had that position since October and have been collaborating very closely with the school district to try to do whatever they could do to make things happen. We are coordinating closely with the district. We are excited that they will be reopening elementary schools, and we're just continuing to work with them to troubleshoot ways in which they may be able to do some kind of reopening for both middle and high school. I do want to say that we do stand in solidarity with the school district. It is, of course, their jurisdiction, and all of the educational considerations and staffing considerations that they have to weigh as they make these very difficult choices. But I just want to underscore our support for the school district and our ongoing collaboration and our hopes to look forward to our kids coming back to school in as safe a way as possible.
Thank you so much. So I want to now turn the floor over to our city manager. And Madam City Manager, thank you for joining us today. And wondering if you can update us about sort of city operations and our city administrative response to COVID-19.
Thank you, Mr. Mayor. It is always a pleasure to have an opportunity to speak with the community and for you in providing this opportunity for us to connect with folks. It's really a pleasure. I haven't been on in a while, so I'm very grateful to be here today. In terms of city operations, 4 things we're focusing very clearly, of course, in responding to the COVID-19 pandemic. Our staff, and especially the leaders on this call, have done an outstanding and exceptional job supporting our community. 3 of our major goals right now as a city, which we're certainly going to stay focused on these goals and push through them. Number 1 are our important municipal services. We are still providing core municipal services to the community. If you look around our city, in just driving around last week, I'm looking at our roads and our medians and sidewalks. People are cleaning, sidewalks are being mowed. We're seeing clean areas under our Gilman overpass. I think a lot of folks are tuned in to a number of things that we see around our homeless community. We have some new things underway with that. We expect very, very soon that we'll have a large homeless outdoor, possibly indoor shelter for our community. We're also focused on a number 2 piece is our budget. Which we'll talk a little bit more. I think a couple of the questions may be around the American Rescue Plan Act, and we'll talk a little bit about that later, but making sure that we're fiscally responsible, that we are ensuring that our needs are met in terms of city services that we provide to the community, and working with our council and figuring out our path forward with our budget. Reimagining public safety continues to be a huge priority for our organization and community. With the mayor and council's lead, we have convened a task force as well as a consultant to make sure that process moves steadily forward. And we have a number of staff that are working on multiple pieces to that project. So we are still moving those things forward. I don't want to spend too much time going into the details of those particular projects, but equally important, and the last thing I want to share is we will be selecting a new police chief soon, within several months from now. But I want to assure the Berkeley community that this will be a robust community process in which folks will have the opportunity to weigh in at various stages of that process. And I think that's important. These are big ticket items for our community moving forward. The budget, reimagining police, selecting a police chief that serves Berkeley and that's here to work on those community values that we find important for our policing department. And then our response to COVID-19. And as you know, from vaccine to testing is still underway. So we still have 2 big pieces in this response that we're still managing. So thank you for the opportunity, Mayor, to just kind of share a few things that are going on in our community and with our workforce. Thank you.
Thank you so very much. So we're going to turn now to your questions. We received a number of questions around City of Berkeley's response to COVID-19. And so I want to first direct these first set of questions to the city manager. There was a question around the City of Berkeley's receipt of $68 million under the American Rescue Plan. And we're obviously very appreciative and excited that the City of Berkeley is going to get this very significant amount of funding to not just address the revenue losses that we've experienced over the last year, but also to help support our COVID response. The question that was asked is, what is the process for determining how this money will be spent and when? I know that we're still waiting for more specific guidance from the federal government around the allowable uses of the funding. The bill did kind of prescribe categories and percentages, but I know that that's one piece of information we're keeping a close eye on.
Thank you, Mr. Mayor. So yes, for the American Rescue Plan Act of 2021, this will be a very strategic process with our Budget and Finance Policy Committee within the city, as well as with the council. Clearly, my role and the role of our departments within the city is to look at all of the needs of our organization and provide a recommendation to the council. It's estimated that we'll receive $68,258,828 dollars. That's just a large number, which we are very excited. And thank you, Mayor. The excitement is there because we do absolutely need this economic windfall for our city. The timing will be split up into two payments. So they'll be probably about 12 months apart. So we'll have to look at our strategies across a 2-year cycle, if not longer, because we can incur costs that these dollars can be used for through December 31st of 2024. So we'll have an opportunity to be very strategic about our needs, our resources, and council will have an opportunity along with community input to make those decisions. We do know that there are some specific allowable uses in terms of these dollars. So responding to the COVID-19 emergency and its economic effects, and those could include everything from effects on small businesses, households, nonprofits, and areas in our city that have been hard hit. It also can be used for revenue replacement for the provision of government services, just basic municipal services, premium pay for essential workers, water, sewer, and just broadband type infrastructure needs. The dollars can be used for those things. We do understand that there are some uses that have been specifically identified that will be ineligible for those uses. And the two that I want to share is an offset of revenue resulting from, say, a tax cut in some way, and or putting money into a pension fund. So we know those two things are off limits. We are awaiting further guidance and regulations, but we'll continue to work through those. We'll make sure that we're responsive to those. We'll be monitoring and we'll be participating and providing any certifications and or reports that we have to provide on these dollars. Now, in terms of the process itself, where I invite the public to be involved is through our budget calendar. This budget calendar is posted on our Budget and Finance webpage under the city, I believe it's under the city clerk's office. If you click on there and go to Budget and Finance Policy Committee, you will see a budget calendar for 2022. And that process will really take off very heavily around May 11th. And I'm going to that date because those are the big dates. This is where we'll have a lot of proposed budget presentations, public health, a public hearing on our budget. We'll propose fee increases. A lot of information will come, and we'll also talk about the end of this past year and provide amendments to that process, and the community can weigh in on information at that time along with the council. We'll have our second public hearing on the budget where these dollars will probably be discussed in some facet on May 25th, and then again June 1st, June 15th, and June 29th. We'll have a number of meetings before the council. So this will be a community kind of process where you can chime in at either a Budget and Policy Finance Committee or at a regular city council meeting. And those are opportunities for the community to weigh in. I hope that kind of provides the information around process. We'll continue to use budget policy guidance that the council's established. So we'll use our policies to guide us in our decision making. And we'll also look at those critical needs across the board for the organization and for our business and community members. Thank you.
Thank you so very much. There was another question around schools, and this resident wanted to thank the city of Berkeley for helping get teachers vaccinated, and acknowledge that our health department says that it's safe, and is inquiring what actions will the city take to ensure that middle and high school students are back in person 5 days a week by the fall at the very latest. I know that Dr. Varhus touched upon this in her initial comments. The district did announce that they are going to start, allowing five-day instruction for elementary school starting at the end of this month, but that they're still in discussion with teachers around the conditions under which they will allow middle and high school on-campus instruction to occur. But I want to turn it over to you, Madam City Manager. I know that we're working with the district to support their process, and our goal is to try to, see a path for them to have on-campus instruction.
This has been a really big challenge for us all, especially the school district, parents and children. We're all struggling to get through this. As a mother of a high school student, I absolutely welcome in-person learning for my child, and that's just my personal plea. But we're all working very, very hard for the community, especially the people on this call right now, along with the school district and our teachers and the parents who are working hard to support the school in every way that they can as well. It is truly up to the school district, right? It's their decision. We've already given them the ability. Now, where can we support them and help and continue that collaboration? I think it's continuing to have those opportunities for staff engagement around health strategies as they begin to open. What things can you do with the requirements that the state has put out there for you? How can we assist them in interpreting them, in meeting them? What kind of testing support can we offer in terms of coordinating them with testing entities or whatever it is that we can do to help support the school district? We are doing that. As you know, we begin even further collaboration at our levels in the organization with the electeds, as well as from my leadership chair and Dr. Varhus and our deputy city manager. We're having these regular weekly meetings now to really sit down and try to hammer things out that we need to hammer out and create good collaboration around communication of information that's shared, so that the public is not questioning, is this correct? Is that correct? Whose job is it? Whose role is it? We want to alleviate the type of concerns that our public may have around what guidance they are to follow. And so clearly it's the guidance of the health officer in the state of California and the school district, but those things always need to be churned and nurtured in a way that the message is clear and clean and people are not confused. And so we've tried to do that very well. I encourage folks to visit our website to take a look at the information there in terms of what guidance is available out there for families, for school districts, for just people in general that are interested in education. There's so much information that's available to folks. And what we can do as a community and as a city is to rally behind our teachers, our school district, our city, and encouraging us to support however we can, not to tear down, but to support each other so we can get our kids back into school. So I want to thank those people those families that are engaged. This has been one of the toughest times as a parent for me. And so I can almost imagine what it is for others. So hang in there, and we will continue to support the school district in that movement. Thank you.
Thank you so much. So Dr. Hernandez, there were a number of very specific questions around masks and guidance post-vaccination and vaccines. And I'm going to try my best to sort of group some of the questions because they're related to some of the same topics. So the first question is around sort of mask wearing. Walking outdoors in my 2-layer, well-fitting homemade cotton mask, I can smell cigarette smoke even from across the street. Does this mean my mask is inadequate? Or are the smoke particles somehow different from aerosols that we're worried about?
So first I'll say it's great that they're wearing a double layered face covering that's well-fitting, which is very important. And you will still smell smoke. The smoke particles from cigarettes are different size than viral particles. So it's not, it doesn't mean that you're not being protected from COVID-19 with that. And remember that one of the primary reasons for wearing a face covering, though it does help protect you from others, is to protect another person, because it's very, very effective of containing your respiratory particles from escaping. So it does both things. But also the other thing is that they're different sized particles, and smoke particles are smaller.
Thank you so very much. Okay. There was a question around sort of activities that people can engage in post-vaccination. So the first question is, this couple has both had their vaccinations, and they're wondering if it's safe for them to drive to Seattle to visit their daughter. So I don't know whether their daughter has been vaccinated, but I know that the guidance that we've seen from the CDC has said if everyone in a household's been vaccinated, that they could gather indoors. But if the other party is not vaccinated, that is a little different.
Yeah, and then you add the layer of what the state guidance is, which is that they haven't released it. So we're waiting. We've actually talked about this as public health officials in the Bay Area, and we are waiting for the state to release their guidance and also modify their travel restrictions. That might not change. So right now, the travel advisory for the state still is in place, which says that you should not be traveling for more than 120 miles for non-essential travel. And then if people come in from, and if you do, you should be quarantining for the 10 days. And if you have visitors, the visitors also should be quarantining for 10 days before they are socializing or out in the community. So that hasn't changed. That's number one. And the state hasn't provided any specific guidance for those that are vaccinated. So that said, I've read the CDC guidance as well, and I feel that the guidance is reasonable and it's based in science. So I think my answer to that question is that you should make common sense decisions. That said, what the guidance says is that those that are fully vaccinated, I want to remind people, means that you have to have, if you've gotten the Moderna or Pfizer vaccine, you've gotten the second dose, and it's been 2 weeks since that vaccine has been given to you, that second dose. And if you've got the Janssen vaccine, it's 2 weeks since that dose. That's when you're fully protected. So a fully vaccinated person is that person that has had 2 weeks since that either second or dose, if it's Pfizer, Moderna, or that Janssen dose 2 weeks after. And then they can visit with other fully vaccinated individuals indoors while wearing mask or without wearing mask and without staying 6 feet apart. Also, you can visit unvaccinated people from one other household without wearing the mask and without staying 6 feet apart if those individuals are at low risk for severe disease. And so those are the guidelines. It also says that you don't have to worry about quarantine and testing, but again, these are the requirements that the guidance that the CDC has put into place. I expect that CDPH, the Department of Public Health in the state, will align, but at this point we haven't gotten them. But again, what I say is make common sense decisions, because every time that you travel, no matter where it is, you are putting yourself at risk. You're exposing yourself. As we get more and more vaccinated, things will be, as a community, will be I think, more lenient at this point. As I mentioned, we have about 16% of City of Berkeley residents. I don't know what it looks like in Seattle. Overall, in the United States, about 10% of the population has been vaccinated. But again, I think right now that's my suggestion, is to make a common sense decision. I think it's great that you're fully vaccinated, so that definitely gives you some leeway.
Thank you so very much. There were several questions around, when the city is going to open up vaccination eligibility for people age 64, or, for example, between 60 and 65, or alternatively, other I guess what they are classifying, what this question is classifying as non-essential workers who are under the age of 65. So I think this might be a good opportunity. I know that we recently announced that we're going to be moving into allowing people 16 through 64 who have certain medical conditions to be eligible for vaccination. But wondering if Dr. Hernandez or Dr. Varsi can touch upon sort of who's next in the prioritization, and whether there's been any decision about what categories of essential workers or individuals may be eligible after that next tier.
Sure, I'll start, and Dr. Hernandez can fill in any gaps that I might lay out, forget. So first of all, up until today, or this week, the categories in which we were able to, per the state of California, provide vaccine, just as a reminder, are people 65 and older, education and childcare workers, food and agriculture workers, and emergency services personnel. As of today, March 15th, the state has allowed us to expand to people aged 16 to 65 that have certain underlying conditions that would further complicate a COVID infection. So we are expanding into that area. With regards to the documentation of that, we are encouraging everybody who feels that they are in that category of 16 to 64 with an underlying health condition to first seek guidance from their medical provider, if they have one, to reach out and say, hey, is this something that I qualify for? You can also find specific guidance or the specifics around which conditions qualify on the state's website. When people sign up for appointments, we are asking them very specifically to attest to, which is under penalty, but to attest to that they actually have diagnosed one of those conditions and therefore qualify for a COVID-19 vaccine. Health information of this nature is very personal. And we feel that our super vaccination sites and the sites in which we provide vaccine, we don't want to ask people to be very public by showing very specific information out of respect for their healthcare. And also because we know that when given the right choice, people will almost always choose the most ethical choice, because we want to make sure that those who really need the vaccine can get it first. So that is our process for that. In addition, I'll add that public transportation workers have now also become eligible under phase 1A. That would include, for example, transit drivers, BART, commercial airline personnel, those kinds of folks. So that's where we're expanding now. Again, we're we must strictly follow the state guidance. And we're also aware that there's some categories of people who should maybe perhaps also qualify, but somehow don't. I had to turn away somebody who was 64 and a half, for example, at a clinic. It did not feel good. It seemed kind of unreasonable. But if we don't follow the guidelines very carefully, then we risk losing our allocation of vaccines. So we have to be very careful. That said, by all accounts, after continue sort of dribbling in vaccine over the coming weeks. We are anticipating and expecting more vaccine to come our way in the months of April and May. Folks may have heard that President Biden, I think over the weekend, announced that by May 1st, any adult in America should be eligible for a vaccine. We want to push first to make sure that those with the greatest risk factors get them, but the time for everybody is coming soon. And so if we could just hang in there just a little bit longer, the coming weeks are going to be, exciting. We believe a lot will happen. We're standing firm on the hope for a very positive 4th of July weekend or holiday. And we just have to sit tight that much longer. We believe, by the way, that the state, if they do incur additional sort of open up categories, that they are going to be going to more of an age-based focus. We don't know the exact ages, and frankly, the state's guidance shifts from one day to the next, but it could be something like 50 to 64 or 65, could be lower age than that. But we would anticipate that at some point they're gonna move to lowering the age qualifications. And Dr. Hernandez, I don't know if there's anything you want to add to that.
I do not. I was just going to add the piece about if I could predict what the state would do, it would be that they would go to an age base. But again, with that qualifying phrase of it could change dependent on how much vaccine we get. So I think that's the factor that we're not sure of, is how much the state will get and how that opens. But I'm extremely hopeful that in the next few months, we will be able to give the vaccine to whoever wants to get vaccinated.
Okay, thank you. So once again, sort of all the people that were eligible in 1A and who have not been vaccinated, 1B to date, plus the transit workers and people 16 through 64 who have certain medical conditions that may result in serious complications due to COVID-19. Those are the categories of people that are eligible to be vaccinated right now. But people, say 60 to 64 who don't fall into the, don't have those underlying conditions, those health conditions that could add further complications if they contracted COVID, they're not at this time eligible for a vaccination.
That is correct.
Okay. And so, one question is, now that some people with disabilities are eligible for vaccines, how do we sign up? Are you limiting the number of vaccines available to people with disabilities under 65? Well, we just, as was noted, we're, opening up that category of people who, and it's pretty clearly defined under the state guidance of the conditions that people may have with disabilities or medical conditions that may add to further complications if they contracted COVID. And so I guess right now, Dr. Hernandez or Dr. Vargas said people do fall within that sort of category. Can they go to the city's website to sign up for an appointment, or appointments available at this time?
So what we know is that appointments, as we post them on the city website, they fill up rather rapidly. We do encourage people, you can go to the city website and you can sign up to be notified when it is your turn to get vaccinated. And we do send out notifications as slots open up. And the city of Berkeley is not the only game in town for getting vaccinated. So I highly encourage people to sign up for My Turn, which is the state website that helps you to both identify when or if you're eligible, and then where you can get an appointment when appointments become available. They publish on My Turn appointments every couple of days, so it can be very helpful to go back and refresh your browser every day or two to see. I'm aware that even some of our own eligible city staff have been vaccinated at the Coliseum, they've been vaccinated at the Cow Palace, they've been vaccinated by their healthcare provider, they've been vaccinated in other parts of the community. So I would actually look at, and Alameda County Alameda County similarly has some vaccination sites, such as at the Alameda County Fairgrounds, where people can get vaccinated. So I would look at multiple options for vaccine. As a city ourselves, in terms of our overall efforts, we're trying to help publish as many vaccine appointments as we possibly can. And we are also setting aside some limited numbers so that we can do more of a targeted outreach approach for people who may not have access to cars and computers and really need more support and guidance around getting a vaccine, whether it's having somebody physically help to sign them up, transport them. So we are doing some smaller vaccination clinics to help meet the needs of others in our community who may not have the ability to get on their computers or jump in their cars.
Thank you so very much. There was a question, this individual noticed that counties gave out fewer vaccines last week, but quote, the state has had 4 million vaccines already shipped. Shouldn't more be given out instead of less? And then there was a related question around this resident did not see any announcements of vaccine availability. I know that we had to reserve some slots for second doses. I guess first question was sort of asking, the data shows that fewer vaccines were given last week. Shouldn't more have been given out? And I guess the similar questions being asked with respect to the Golden Gate Fields point of distribution. So I don't know if there's anything that you know, Dr. Varhus or Dr. Hernandez, around that. And then we could certainly speak to the city of Berkeley. I don't know if we could speak to the state of California.
Well, what I will say is, if you actually look, and I encourage people to go to our super cool new vaccine dashboard up on our website, so you can see both the number of first doses that have been allocated as well as the number of people that are fully vaccinated. We are, I think I saw a number of around over 50,000 of City of Berkeley residents have received at least one dose, which is quite outstanding. You'll also notice, however, that the number that is fully vaccinated is quite a lot less than that. And from that, you can deduce what's happening, which is that a lot of our current vaccination effort is really targeted towards second doses, especially at the Golden Gate Fields pod. So our capacity, this week alone, I think we're providing all second doses with the exception of one day where we're able to provide 300 first doses. And so once we have caught up a little bit in the second dose capacity, we'll be able to also go back to more first doses. You'll also notice that the amount of vaccine that seems to be available seems to be quite high compared to what we've given out. And that is because the vast majority of that vaccine has to be set aside for second doses.
Yeah. Thank you very much. A couple of questions around the eligibility for health conditions, and the California Department of Public Health's sort of list is narrower than CDC's at-risk list. And it was noted that San Francisco Public Health has kind of opened up a broader list of health conditions that would be eligible for vaccinations in this next tier of 16 through 64. So the general question is, is Berkeley considering potentially expanded criteria for that category of health conditions, similar to what San Francisco is considering? That might be a Dr. Hernandez question.
It is a Dr. Hernandez question. Yeah, I know. I just saw that from San Francisco, and right now we're not going to expand our criteria. Again, what Dr. Varhus said in the description of the eligibility, we do feel that that individuals should speak to their healthcare providers if they have one to see if they do meet the criteria that is set forth by CDPH, by the Department of Public Health, in terms of being at higher risk for morbidity or mortality, or basically severe disease or death from COVID. And I do wish that they would open that category even broader, both the state and CDC, because I believe if I look, unless they modified it, which they could have, CDC did not include HIV on the list, but San Francisco did, and I support San Francisco in doing that, and we'll look into it and talk with the state, but at this point, we're not ready to deviate from what the state has allowed.
Okay, thank you. So there's a question around sort of mobile vaccination capability for persons experiencing homelessness. And I know that we recently announced that we're going to be moving towards vaccinating people who are experiencing homelessness. This question's asking, sort of Berkeley's efforts to reach people who are homeless to make sure that they can get access to vaccinations. And there was actually a really great article on Berkeley site about this. I think it was last week. So I know that we're working in coordination with service providers, and I would imagine Lifelong also, but Dr. Varhus, you and Dr. Hernandez, you would know better than anyone.
Yeah, so thank you. That's an excellent question, and we appreciate it. Vaccine equity is a huge priority for us in Berkeley. And while I believe we've spoken here before about sort of the pressure from the state and the feds to make, get shots in arms as quickly as possible, that speed sometimes hinders equity. And so we've really we had to initiate our vaccine rollout with a focus on making as many appointments available to eligible members as possible and vaccinating them. And now that we've created some stabilization both at the Golden Field point of dispensing site and also at other sites that we're able to pop up specifically for certain worker populations, we're really now starting to up our equity game. And so I'll just share some of the things that we have started focusing on. So first of all, we're working through the vaccination for workers and residents in Golden Gate Fields, particularly those who are victims of that substantial outbreak last year because of their congregate setting situation and vulnerability. The state health officer has allowed us to vaccinate that group, and we're extremely grateful and glad to be able to create some equity at Golden Gate Fields after a very difficult end of 2020 over there. We've also initiated vaccinations for people experiencing homelessness and the staff that work with them. So last week we did a clinic at Boss Harrison House and at the Safer Ground respite sites, where we were able to vaccinate 14 people experiencing homelessness. This year we'll be providing a clinic with Dorothy Day House that will also include residents of the Stair Center. And Lifelong Medical also reached out and did a vaccination clinic at People's Park, which a number of people experiencing homelessness were very, very, very glad to have participated in. And I've gotten a few emails today from folks hoping that there is a repeat of that. We are also beginning this week to vaccinate our very vulnerable mental health community, mental health patients that are part of our Berkeley Mental Health, and our great Dr. Jeff Johns, who is one of our psychiatrists, has stepped up to help provide those vaccines to all of the people in tier, including especially those 16 to 64, of which we have many clients in that situation. And we've been coordinating with the county this whole time. We haven't spoke with it so much here, but we've been coordinating to provide vaccinations to people in senior homes and long-term care facilities and affordable housing complexes. So just to name a few places where we have worked with the county to ensure vaccinations happened, include, for example, Strawberry Creek Lodge, Harper Crossing, Maple Howard, Sacramento Senior Homes, and several other places. All of our skilled nursing facilities and long-term care facilities, all of the residents and employees who've wanted to be vaccinated have been vaccinated. We've done a significant outreach to our childcare community that have really struggled to stay alive and well over the pandemic. And we are implementing smaller vaccine pods in the community. We are doing targeted outreach to communities of color in particular who have been most vulnerable to COVID-19, and we'll continue to work with community partners to do those going forward. So those are just some of our initial equity measures. There's lots of work to be done still, but we are extremely committed and so also so grateful to Mayor and Council and the city staff who really see equity as one of our primary obligations.
Thank you so much. Last question, there was a question from a resident. My 29-year-old son is needle phobic and would like to get the 1-dose Johnson & Johnson vaccine. Where and when can he do so? I guess that gets to kind of the initial statement you had made, which is really you should just get whatever vaccine you can get when it's available. But I know that the Janssen vaccine is just coming out. So it's certainly not as available as the Moderna or Pfizer. But I don't know, Dr. Vargas, you have any thoughts?
Well, I'll just add that I have a 29-year-old son who's actually turning 30 on Thursday, and he is also needle phobic. He is a teacher and trying to get back in the classroom. And so I took a lot of prodding to get him to get his Pfizer vaccine with Alameda County. Yeah, I totally feel the needle phobic thing, and we will have Johnson & Johnson, and hopefully that will be an option for him.
Thank you so much. One last question was asking what the city is doing to help businesses recover from the pandemic. I could certainly speak to what we've done since the pandemic started. As I noted, I think it was March 17th, 2020 was when the shelter-in-place order first took effect. And that evening, we had our last in-person meeting of the Berkeley City Council. And we voted on several important initiatives to help our small businesses. One, we adopted a moratorium on evictions, not just residential, but commercial evictions. And so if you are a business in Berkeley and you're not able to fully pay your rent due to significant loss of income due to COVID-19, you have a defense against eviction in the city of Berkeley. Ultimately, our small businesses will have to pay the back rent, but you cannot be evicted for non-payment of rent if you are a commercial tenant in the city of Berkeley. Recognizing that some of our small businesses also, we're facing extreme hardship, and we're on the verge of closing. Some had laid off their workers. Some were considering significant reduction of their employed staff, and we're waiting for money from the federal government. We launched also the Berkeley Relief Fund, which raised over $1.5 million in private money, and that was matched with $3 million the city put in. And that money was really critical to provide sort of emergency grants to small businesses. I think we helped, well over 700 businesses in Berkeley with the emergency relief grants that we provided. And then we worked with the county to expand eligibility for the county CARES grants as well. That initial, and we're still raising money through the Berkeley Relief Fund also. So if you have or will be receiving your stimulus check from the federal government and would like to donate some money to the Berkeley Relief Fund, we are still accepting tax deductible contributions to the Berkeley Relief Fund. You go to berkeleyReliefFund.org. I will be donating a significant portion of my stimulus check towards the Berkeley Relief Fund. And that will provide direct financial assistance to our small businesses that are still struggling during this pandemic. While, we're in the red tier, more things are opening, it's extremely hard for our businesses. And, we need to help support them. We also have helped them transition towards, allowing dining and certain commercial activity outdoors, not only through just public health guidance, but also through providing economic assistance so that businesses can, and also permitting so they can open up parklets, and also we create a grant program so that they can apply for funding to expand their business activity outdoors. And then, we are committed to helping the businesses after we get through this pandemic. We know there's a lot more work that has to happen also. So we know that, the pandemic hasn't just affected people who've contracted COVID-19 and their family members, but also our business community. Sadly, we've lost some really treasured businesses that are never going to reopen. And, while, we mourn the loss of lives, the 2.6 million people that have died worldwide, and the 530,000 people that have died in the United States, and the over 30 people in Berkeley who've succumbed due to COVID-19, we also know that the impact has also been felt, across our community, not just in people, loss of lives and people who've been affected by the public health crisis, but the economic crisis that it's also created. And so, we know that, we can't just focus on, just the public health response. We have to focus on the economic response as well. So, we're committed to providing whatever support we can now, and then certainly after the pandemic also. So those are all the questions that we received today. And we want to thank those Berkeley residents who submitted thoughtful questions, and thank our team of city leaders for your time today and for providing important information. Before we close, I want to give our city leaders the opportunity to say some final words if they would like to the Berkeley community. And I will go first to Dr. Varhus, if there's anything you'd like to add before we close. Any final words to the Berkeley community?
Yeah, I know. Thank you, Mayor. Thank you again for having us. We have some very close working relationships in the city of Berkeley. One of the things that I've been really happy about since I've been here for about a year. So I want to also thank the city manager and the health officer, two of my favorite colleagues here in the city. I want to say this. It's something that I said to my parents this afternoon who have been fully vaccinated. They're both approaching their 80s. Recently, after spending a year, a good year in isolation at home, they're slowly venturing out. Given what Mayor just said about the economic recovery of our city, if you have means and if you have been vaccinated, it's new, it's been a long time, but if you have the ability to actually go out and have that dinner in an indoor restaurant at 25% capacity, or outdoors, or you have the ability to visit your favorite tattoo parlor or your favorite hairdresser salon, or you finally get out there, I just really want to encourage you to do it, because that actually is going to help all of us. And everybody deserves to be vaccinated, and we will get there eventually. But if those that have, I know you've given up a lot in a year, but if you're able to get out and, spend a little money in Berkeley, be a little visible in public, that would really, really do a great service to the rest of our community. So I just really wanted to encourage that. And I hope everybody has a great rest of their week.
Thank you so very much. Dr. Hernandez, any final words you'd like to share with the Berkeley community before we close?
I do. I was reflecting on your opening remarks about where we were a year ago. Totally different place than where we are now. The words that come to mind from a year ago are dread, fear. I can think of a bunch of others, but those are the big ones, because we were in a place globally where we didn't ever expect to be with a pandemic of this extent, and we were faced as city leaders with making a decision that was unprecedented to protect our community. And that's what we were thinking about a year ago. And here we are, fast forward 364 days, and we're in a much better place, both with our what we know about COVID-19, how we know how to protect ourselves, and we have the hope of vaccine, where we have at least 16% of our city of Berkeley residents fully vaccinated. That's amazing. So it's amazing that we're able to talk about that, and then also talk about the future, and encouraging people to be out and about more than they were. I still want to say we're not out of the woods yet, but we see, as we've heard others say, that bright light at the end of the tunnel. We definitely see hope, and this is a great place to be. And I just want to not only thank you, Mr. Mayor, and the Madam City Manager, and my boss, Dr. Varhus, but all of the city team that has really worked and to keep the city safe, and then also the city community, the residents and those that work in the city for abiding by the recommendations of public health.
Thank you so very much. Madam City Manager, any final words for the Berkeley community before we close?
Yes. These, of course, they have said everything that I would love to say. I just want to take a few moments, Mr. Mayor, and just thank you for this opportunity where you convene and get us out there in front of our community. And I don't know if you get thanked enough by folks. I don't know if you get any nice little notes that say, thank you, Mr. Mayor. I know that we want more and more and faster, but I applaud you for this effort. I applaud you for supporting us and always recognizing the good work that we're doing, but there's a lot of amazing work that you're doing and your staff in your office. And I just want to acknowledge that we wouldn't be here today having these regular, consistent briefings with the community and addressing their questions if it wasn't for you. So while Dr. Varhus and Dr. Hernandez and me and our city team, we work really hard, no doubt. They are some of the hardest folks I've ever worked with, but I need to say that so are you. So thank you for your leadership too, and thank the Berkeley community for spending time with us.
Thank you so much, Madam City Manager. I just want to thank, once again, the three of you. You have really done incredible work. Know that you have saved lives. We know we're not out of this pandemic yet. And so I really want to, just remind the Berkeley community that the importance of this physical distancing and the, wearing face coverings and all the public health measures that we have adopted over the past year, but to thank you for your sacrifice and your diligence and your vigilance, because it really has made a difference. So thank you all so very much. Have a great week, and stay tuned for our next town hall meeting, and be safe.